We're joined in studio by GP Dr Helen Wall, and it's significant. You are Clinical Director of Population Health for NHS Greater Manchester. Yes. Long title, but that means you're in charge of immunisations, right?
Yeah, amongst other things, yeah.
So this is not anecdotal. This is, and everyone has those conversations. Lots of people have got bugs and flus, and this is real. There's a whole bunch of things all happening at the same time.
This is very real, and the impact that it's having is very real. You know, at the start of December this year, we had 95% of our hospital beds occupied, which we always get to at some point in winter, but it's much earlier than we would normally be at that point. You know, we were 350% more cases of flu at the beginning of December than this time last year. And as we've just heard, you know, nearly 1,900 people every single day last week in hospital with flu somewhere in England. It's huge. And the concern is that this has a knock-on impact on everything across the health system. So all health services have seen the busiest October. In November, we had the busiest A&E on record, attendances up by 7%. We had the highest ambulance call-outs, up by 6%, that we've ever seen in any November on record. So, you know, it's a huge impact. 111 calls have gone up. Everything is already feeling that pressure.
Who is not taking up vaccines?
I think, you know, we've got different categories of people, and there is a huge difference in those who are going for the vaccine and there aren't. So our elderly population, by and large, are very keen to take the flu vaccine, and we've hit about 75% of those individuals across England who've uptaken that vaccine. The people who perhaps aren't as quick at coming forwards are our clinically at-risk individuals. So that's our people who don't necessarily qualify by age, by being over 65, but have other clinical conditions. So they've got diabetes, they've got asthma, COPD. They are eligible for the vaccine, but only 30-odd% of them, and it does vary slightly across the country, but on average 30-odd% of them have come forward for the flu vaccine, which is a concern because there's still millions of people out there who are eligible and haven't yet had that. And next week, we've just got 1 week left before the National Booking Service will cease for people to book that vaccine. So the vaccine will still be available.
Oh, right, OK.
It will still be available. GPs will still have flu vaccines, pharmacies will still have flu vaccines, but the National Booking Service, where you can go online and find where to go for the vaccine and book it, ceases next week.
And what if you're, say, someone like my age, who thinks, actually, I've had a few colds, I just really don't want it, I'd like the flu vaccine. Yeah. Can anyone have it?
Anyone can have it, but there's only certain people who are eligible on the NHS. So you can go to a pharmacy and there will be a small fee for that if you want to be vaccinated and you don't qualify. But there are lots of reasons why you may qualify: pregnant women, all children in schools, immunocompromised, certain ages clinically at risk. So do check first whether you're eligible, because you may well be able to get that for free.
This quademic phrase that has come in now, this incorporates, amongst other things, norovirus. So what are you seeing?
We're seeing a lot of norovirus, which is essentially gastroenteritis. So people get diarrhoea, vomiting, stomach cramps, fever. It's a really horrible illness, and it's also known as the winter vomiting bug. And again, that shot up the number of cases that we're seeing of that. And I always tell people, because I don't think people understand this, alcohol doesn't kill norovirus. You have to wash your hands with soap and water. Yeah. So hand sanitizer. You know, we see a lot of people using hand sanitizer, carrying it with them. It's great for most viruses and bacteria, but it doesn't kill norovirus.
But norovirus, I mean, protection against, is there?
No, there's no vaccine for it. It's essentially having really tight hygiene, so making sure you're washing your hands with soap and water thoroughly before eating, after going to the toilet. If you've been in contact with them, it can linger on surfaces. You know, it's not just about in the air.
And if someone in your household has it, you isolate as best you can, is that?
Yeah, I mean, it's hard, isn't it? If you've got children who have it, you've got to hot wash all the bedding, you've got to wash your hands after you've been in contact with them, don't share towels, just try and, you know, maintain those hygiene practices. It's really difficult if you're living with people who have it.
What have you noticed? Because it sounds like, you know, we could go back a few years and be in the pandemic, couldn't we? You saying wash hands, you know, and all that. Yeah. What have you noticed in terms of habits, and has it changed? Are we seeing more of these kind of illnesses kind of spread because we've eased off on the washing hands?
100% we've eased off. I mean, you only have to go into any setting and, you know, at one time in the pandemic, all the alcohol gel, I know we've just said don't use hand sanitizer for norovirus, but you know, for flu and other things, it was everywhere, wasn't it? Hand sanitizer. Everywhere's empty now. You go into any sort of supermarket, you can see the hand sanitizer stations, but they're empty. People have taken their eye off the ball in terms of those hygiene measures. And, you know, none of us want to go back to the social distancing, the mask wearing, but the simple, basic hygiene measures of hand washing, you know, not being careful around people that are ill. We can't forget about those because it's so simple. Exactly. Yeah. Sneezing into a tissue, binning it, washing your hands. It's so simple, and it does linger on surfaces as well for a long time. You know, so disinfecting your surfaces at home, door handles, things like that. I'm not trying to make people go crazy trying to stay clean, but it does make a difference.
Helen, thank you. That's Dr. Helen Wall speaking to us. We should say a little later on, 8:30 this morning, speaking to Susan Hopkins, who's the Chief